All this is Dr. Mubin Sayed from drbeen.com. Welcome to one more show. Do you know that in 5 days I'll become 54? 54. So with this, the life looks like just as short as this. Okay, so I wanted to discuss berberine. We are continuing with our series on berberine. We talked about diabetes mellitus. We talked about its effect on beta cells, liver, and I want to continue with the other effects, for example, on cardiovascular system, on eye, etc. However, I thought it is important to look at the side effects and toxicity before we continue so that you can be careful if you are going to start using it, or you can have those discussions with your doctor. And some folks made this comment last time that it is not necessary that all doctors know this. In that case, at least you should be able to do your research too. I have done some research today. For example, I looked up the berberine and its just regular effect and side effects and toxicities. I looked it up for renal patients, for pregnant mothers, and for lactating mothers, for babies. So let's start from here, and then we can dig deeper, or you can dig deeper as well. So with this, let's start. So this is drbeen.com. In the description of this video, there is a link to the best discount you can ever get on Dr. Bean, which is about to go away as well, because as you can see, our CMEs are here, and now we are going towards courses soon. So take advantage of that. If you have gotten access, then we'll grandfather you. But if you have not, then we'll be offering these videos with courses and course prices only. Okay, with this, let's start from here. This is a good one, Medline Plus. And here, there are many topics here. What is the berberine's use, etc. But I want to go to the interactions. And there are going to be some more papers that I would show you where the reasons for these interactions can also be understood. But let's first see in a pure, crisp way the interactions. Major, do not take this combination. Cyclosporin, berberine might decrease how quickly the body breaks down cyclosporine. This might increase the effect and side effect of cyclosporine. And so consider this, that berberine, because it goes to liver, it works on the liver cells. One outcome of that is that it can modulate the liver cell enzymes, and that can cause those drugs that will be broken down by the liver cells enzymes, for example, cytochrome P450. Those drugs may have longer or prolonged duration of action, or even higher potency because of more accumulation of these. So that is what is important to look at these. So cyclosporine, do not take this combination at all. Moderate, be cautious with this combination. Dextromethorphan or Robitussin. Berberine might decrease how quickly the body breaks down dextromethorphan. So once again, as it modulates the liver enzymes, and they do not break down the other drugs that fast, that would cause those drugs to live longer or accumulate more and have a more potent effect. And some of these potencies might cross the toxicity window threshold and cause toxicity. So dextromethorphan. And I want to say this, that if you have been taking berberine and it has been safe for you, then this should not act as a deterrence. Instead, your own body, your own labs, your own status should help you understand. For example, I've been taking it for a few days. So far, no issues. Then losartan. The liver activates losartan to make it work. Berberine might decrease how quickly the body activates it, which might decrease the effect of losartan. Then medication changed by the liver, so cytochrome P450. So there are lots of drugs that are affected by that. I'm going to come in here and discuss some more. Medications for diabetes. Berberine might lower blood sugar levels. Taking berberine along with diabetes medications might cause blood sugar to drop too low. Monitor your blood sugar closely. I have seen that berberine by itself actually is not capable of doing a lot of hypoglycemia, but when I am taking it, I continue to check my blood glucose just to make sure what is the kind of effect it is producing. So just make sure that you get ahead of understanding how it works with your body. Medications for high blood pressure. And we're going to talk about the blood pressure and berberine separately. But here, berberine might lower blood pressure. Taking berberine along with medications that lower blood pressure might cause blood pressure to go too low. Monitor your blood pressure closely. Medications that slow blood clotting. So it seems like berberine can act as a small, weak blood thinner, but when it is combined with other blood thinners, it can potentiate their effect by modulating the liver enzymes. So berberine might slow blood clotting. Taking berberine along with medications that also slow blood clotting might increase the risk of bruising and bleeding. Very important. Then metformin, glucophage. Berberine might increase the amount of metformin in the body. So once again, it would reduce the breakdown in the liver, so the amount of metformin will increase. This may increase its effect and side effects. This interaction seems to occur when berberine is taken around 2 hours before metformin. 2 hours before metformin. Taking berberine and metformin at the same time doesn't appear to increase the amount of metformin in the body. Then midazolam. The body breaks down midazolam to get rid of it. Berberine can decrease how quickly the body breaks it down. This might increase the effect and side effects of midazolam. Then pentobarbital. Pentobarbital is a medication that can cause sleepiness. Berberine might also cause sleepiness and drowsiness. Taking berberine with pentobarbital might cause too much sleepiness. Now, I have not seen this effect I think I take 600 milligram morning and 600 milligram in the evening. So once again, it's going to be different for everyone. I am just one person, and that is just one person's experience. It doesn't mean you'll have the same experience. Sedative medications or CNS depressants. Berberine might cause sleepiness and slowed breathing. Some medications called sedatives can also cause sleepiness and slowed breathing. Taking berberine with sedative medications might cause breathing problems and or too much sleepiness. Then tacrolimus is removed from the body by the liver. Berberine might slow down the body's ability to remove tacrolimus. This might increase the effect and side effect of tacrolimus. And then there are more over here. My request is to read this. I want to go to the second one. This is 2015. Study progress of berberine for treating cardiovascular diseases. So here, what I wanted to show you was some of the pharmacokinetics of berberine. So this, I think, is a very important area. You can look at the remaining paper if you like, but here I want us to look at this one. Berberine has low bioavailability. So this is the first thing. When we take berberine, it doesn't absorb very well. So there is a low absorption, and that is lesser than 5% is absorbed. And the reason is that there is an enzyme called P-glycoprotein appears to contribute to its poor absorption, actively expelling the alkaloids from the lumen mucosal cells. It's so funny. So this enzyme is sitting inside the enzyme. So imagine there is a person sitting in a home, and then Amazon driver comes in and brings something. And imagine if they push that thing in the house, then this person from inside throws it back out. So that is what this enzyme does with the alkaloids. and berberine is a kind of alkaloid. So when the berberine is actually absorbed or taken up by the cells, this enzyme sitting inside actively rejects it and throws it back out. So that is how it is expelled again. So in a rat non-compartment model, unbound berberine, this is also very important, that what is the effect of berberine on kidneys? And if you would read this, what you'll find out is berberine is primarily metabolized by liver and excreted through bile, that means through GIT, that means in the stools. Very tiny amount of berberine is actually present in the urine. So if you see here, unbound berberine is transported to bile through active transport, and it is metabolized by a P450 enzyme system in the liver with phase 1 demethylation and phase 2 glucuronidation. So these are just the ways liver breaks down various drugs. There are phase 1, phase 2, in which it continues to change them. Berberine has 4 main metabolites, so I'm going to leave them. Intestinal bacterial flora takes a role in enterohepatic circulation. Enterohepatic circulation means that something is present in the intestine, it is absorbed from the intestine, taken up in the blood circulation, goes to liver, then liver puts it in bile and moves it back into the intestine, and so here is a circulation. This is called enterohepatic circulation, where things are excreted in the bile, then reabsorbed, then excreted, then reabsorbed, and so on. In that process, some of the material also escapes towards stools and is released or excreted. So intestinal bacterial flora takes a role in enterohepatic circulation of berberine and its conjugated metabolites. On the other hand, a very small amount of unchanged berberine is eliminated in urine. So the question is, how small? Let me show you that. So here, this study, number 6, is the study that I have open here. So they detected berberine in plasma, urine, and bile. So bile will represent berberine in the enterohepatic circulation and being eliminated through stools. The plasma would represent the berberine present in the blood, and urine berberine will represent berberine excreting through the urine. So check this out. Plasma, urine, and bile. In plasma, 18.1 nanogram per milliliter. In urine, 2.3 nanogram, 2.3. And in stools or in bile, I shouldn't call it stools because all of this will not end up in the stools. So 90.4 nanogram. Majority in bile, a very tiny amount, 2.3 in urine, and another level in plasma, 18.1. So if I go back here, on the other hand, a very small amount of unchanged berberine is eliminated in urine. Berberine may inhibit CYP2E1-like enzymes, which is not related to significant increase in pharmacological interaction since most available drugs are not metabolized by these enzyme systems. Then, standard dose of berberine are generally well tolerated and eventually adverse events are rare and mild. On the contrary, high dose has been associated with arterial hypotension, dyspnea, flu-like symptoms, GIT discomfort, constipation, and cardiac damage. The most studied side effects are those in the GIT. Berberine and derivatives can also produce gastric lesions. Now, I'm going to also show you what is the toxic L50 of the berberine in a minute. The safety issue of berberine mostly involves the risk of some pharmacological interaction. In fact, berberine, this is a very important one. In fact, berberine displaces bilirubin from albumin about 10-fold better than phenylbutazone. Thus, any herb containing large amounts of berberine should be avoided in jaundiced infants and pregnant women. Berberine displaces warfarin, thiopental, tolbutamide from their protein binding sites, increasing their plasma levels. Now, I would show you another study about the pregnant women and for the children. It is completely recommended not to be taken by children and by pregnant women, although data is really low. But for newborn, if imagine if the woman was taking it, pregnant woman, and if it goes to the child, then because berberine separates the uh, bilirubin from albumin, the bound state, that bilirubin that is separated will go to the brain because a child's brain system is still being developed. So blood-brain barrier cannot really stop the bilirubin from coming into the brain tissue. And if bilirubin goes into the brain tissue, it will bind to the brain tissue and cause kernicterus, which can cause babies brain damage or even death. So berberine itself may be safe for the woman herself, but when it goes to the child, the fetus inside the mother, then it can be dangerous for the child. Because of that, don't give berberine to children or to pregnant mothers. Once again, it may be safe for the mother, but it is teratogenic for the child, and that is, of course, a no. So this is another, and there is a lot more in here which is very, very interesting. I would once again recommend that you look into this paper. Then I just went through this one, small amount in urine. Then here, what is berberine used for? Drugs.com. Berberine is an alkaloid derivative and is found in the roots, rhizomes, bark, and stems of barberry, golden seal, and other medicinal plants. Golden seal is a plant that is here in North America. So where does berberine come from? For at least North America, golden seal is an herb of the buttercup family and found in North America. However, when people take golden seal by mouth, very little berberine is absorbed into the bloodstream. So study results on berberine may not apply to golden seal, according to the National Center of Complementary and Integrative Health. So if somebody is taking golden seal as a medicine, it is not necessary that the berberine, which is present in it, will be absorbed and be useful. Then they say it is present in other plants as well. Now, safety. Stomach pain, diarrhea, gas, nausea, vomiting, dizziness, fainting, headache. We discussed this before as well. I'm just showing you various articles addressing this effect. Effect on the heart, like low blood pressure, slow heart rate, and abnormal heart rhythms may occur with higher doses. And once again, what is a higher dose? I'll show you. I think it is 2.8 milligram per kilogram. But I'll actually show you where it is written. It'll come. Allergic reactions have been reported. According to NCCIH, berberine may cause or worsen jaundice in newborn infants and could lead to a life-threatening problem called kernicterus, a type of brain damage. Do not use this medicine in children unless recommended by your pediatrician. I don't think pediatrician would know or recommend this. And then talk to your healthcare provider, which is a standard message. Of course, talk to your provider. Does berberine have drug interactions? So once again, the same message here as well, P450 or cytochrome P450. And then berberine may have side effects with medicine used to treat diabetes, heart disease, high cholesterol, high blood pressure, blood thinners like warfarin, and can cause drowsiness and sedation. Caution is warranted with co-administration of potentially toxic medicines such as cyclosporine. So that is that there should be no co-administration. And then they have a list. I'm going to continue. This is another way. This is another substance. So barberry, which also has berberine. So contraindication, caution is warranted in the presence of cardiac arrhythmias. Do not use in the children. Pregnancy, avoid use. There are documented adverse effects, including uterine stimulant effect, which can cause abortion. So here is the toxicology. Symptoms of poisoning are characterized by lethargy, stupor, daze, vomiting, diarrhea, nephritis. A median lethal dose for berberine was noted as 27. So I said 2.8, so totally wrong, 10 times wrong. 27.5, I'll have to edit that out. 27.5 milligram per kilogram in humans. And of course, that's a very high dose. Berberine showed mutagenicity in yeast cells and Ames test, while a phototoxic reaction between berberine alkaloid and ultraviolet A light has been described. So more importantly, 27.5 milligram per kilogram. So in a 70 kilogram person, what is the toxic dose, or actually not toxic, LD50? If I take 27.5 multiplied with 70, so 1924 milligrams. So that can become toxic. So just be careful. Then, golden seal use while breastfeeding. Golden seal root contains berberine and other isoquinoline alkaloids. Golden seal has traditionally been used as an anti-infective, both for systemically and topically, although high-quality studies of its efficacy and safety are lacking. It has also been used to mask illicit drugs in the urine, although it appears to be ineffective with modern lab methods. Golden seal has been used topically by nursing mothers to treat sore nipples. No data exists on the excretion of any components of golden seal into breast milk or on the safety and efficacy of golden seal in nursing mothers. Berberine can displace bilirubin from serum albumin, causing concern about exposure of newborn infants because bilirubin can build up in the infant's brain, causing brain damage. However, the extent of berberine's passage from the mother to the infant is unknown. So we don't know how much berberine actually goes from mother to the child, the fetus. Most sources recommend avoiding exposure of neonates to golden seal via breastfeeding or otherwise. So that is about the breastfeeding. Then, and I see Carol says, I'm not sure if I agree with this paper. Carol, which paper? I am going through a number of them. I would like to hear which one seems to be not that agreeable. Okay. Then some more berberine and renal effects. Berberine reduces. So the reason I was looking at berberine and kidney was to see that does berberine cause impact on kidney, especially in the chronic kidney disease patients. Now, chronic kidney disease can occur for many reasons, diabetes being one of them, atherosclerosis can be another, and there are other diseases as well. So the basic, I think, approach in the CKD is to, for sure, do not use anything. It's not just a berberine. No addition or subtraction without discussing with your doctor, because kidney can become impacted very quickly. Here, I was trying to see if the berberine circulates through kidneys, what kind of effect it has on the kidney. And so once again, this is 5 January 2022, more recent article, quite recent article. Let's see what it does. Abnormal lipid metabolism in renal tubular epithelial cells contributes to renal lipid accumulation and disturbed mitochondrial bioenergetics, which are important in diabetic kidney disease. So what they're saying is that in a diabetic kidney disease, the nephrons that are making urine, of course, these are microscopic tiny tubes. The surface cell, epithelial cells of the tubes, they become laden, they become filled with lipids. And that is how the mitochondria gets damaged, the epithelial cells get damaged, and the kidney damage starts occurring. So here in this study, what they showed was that berberine actually reduces, I had it marked somewhere. Let me just. So in this study, they showed the present study aimed to investigate the protective effect of berberine on lipid accumulation in tubular epithelial cells of diabetic kidney disease. These data suggest that berberine alleviates, they didn't say cures, they didn't say fixes or any manages. They use the word alleviate. So it's not a robust effect. These data suggested that berberine alleviates diabetic renal tubulointerstitial injury through improving high glucose-induced reduction of fatty acid oxidation, alleviates lipid deposition, and protects mitochondria in tubular epithelial cells. The mechanism seems to be very similar to the one that I discussed with liver. So if you're more interested in the mechanism, please see, I discussed that yesterday or on this Friday. But eventually, berberine seems to be, from this paper's point of view, alleviating the pathology of diabetic kidney. So this is a very important paper. So Carol says, just tuned in late. Sorry, I take berberine on and off and never notice any problems. I never saw any information like this. I would look into this, whether this was known to be safe. So this is shocking. No, so Carol, these side effects are not, the point is not that the berberine is going to make the sky fall. The important thing for me was that as I'm discussing how good it is, I'm taking it every day, no issues at all, not even GIT disturbances. But the point was that as I discuss berberine and its effect, I want to make sure that we have all at least once looked at what are the possible side effects, how many people get them. I think that is not it's not going to happen to everyone, but still it will happen to some. So we should at least see them. And please do look into them. All of these are well-published papers. But this does not mean, for example, after looking at this, I will not go and say, all right, I'm not going to take my berberine. But if somebody who is on blood thinners or somebody who has cardiac arrhythmias, or a pregnant woman, or a young child, or someone who's taking cyclosporines, it is important for them to be very careful. Or someone who has drugs that interact with the cytochrome P450 of the liver. And cytochrome P450 is a target for many medicines, not just with berberine. And so it can be modulated by many other substances too. So I don't find anything shocking here. And that may be because I'm used to reading a drug, its mechanism of action, its indications, meaning when should one use it, its therapeutic dose, which means it is safe for most people in that therapeutic range, its side effects, toxicity, and how to help a patient if they develop side effects, to change the dose or withdraw the drug. And if they become toxic with it, or if the drug becomes toxic, then how to help. This is a normal standard way of reading or knowing about a drug. Okay, so this is very interesting. I had thought that berberine will actually cause stress on the kidney. But here, at least, you can see it, 5 January 2022, Renal Pharmacology, berberine reduces lipid accumulation by promoting fatty acid oxidation in renal tubular epithelial cells of the diabetic kidney. Very important talk. Okay, so then, this is another. Berberine ameliorates chronic kidney injury caused by atherosclerotic renovascular disease through the suppression of nuclear factor Kb signaling pathways in rats. Very, very interesting. This is a very similar thing to ivermectin. So once again, I was trying to figure out, will it cause damage to the kidneys? And once again, somebody who has chronic kidney disease, they must be very careful. These papers kind of allude to a possibility of berberine actually helping it. But of course, I cannot say that go take this, it would help the kidneys. One has to talk with the doctor, especially with the kidney disease. Okay, so here, this is a little older paper, 2013. Impaired renal function in atherosclerotic renovascular disease. That is, there is atherosclerosis, which causes the blood vessels to become hardened, which causes impaired modulation of the blood vessels within the kidney. Kidney is a very important place. It has labs. Not only it makes urine, but it has labs for blood pressure monitor. Imagine around every kidneys capillary, where there are millions of them, there is a blood pressure cuff. You know that there are actually the cells called macula densa cells, which work with another set of cells that are around the blood vessel. They act as a blood pressure cuff. So our kidney has millions of BP apparatuses in it. And at the same time, the same macula densa and some other parts of the nephrons, they have chemical sensors as well to understand what is the pH and what is the osmolality of our urine, to understand, are we making concentrated urine or diluted urine? And based on that, the kidney tries to figure out what is the fluid volume in our body. And then it works with the renin-angiotensin system to maintain blood pressure and blood volumes. Such a beautiful structure kidney is. However, when we develop atherosclerosis for whatever reason, then of course blood vessels in the kidney will become affected as well. And when they become hardened, they do not monitor the blood pressure very easily. And so then we start developing hypertension. Sometimes the blood vessels are so thick or hardened that enough blood does not reach kidney. And kidney thinks that somehow the blood pressure is low in the body. That is why not enough blood is going to the kidney. And as a result of that, it starts making renin-angiotensin system, more renin, which would then cause more angiotensin production, which will then cause more blood pressure, right? So I was kind of looking at what will berberine do to the kidney. And this was very interesting, that impaired renal function in atherosclerotic renovascular disease, one pathogenetic mechanism is diabetes. Maybe the result of crosstalk between atherosclerotic renovascular stenosis and amplified oxidative stress, etc. Berberine regulates, this is so nice. Berberine regulates cholesterol metabolism and exerts antioxidant effect. Accordingly, we hypothesize that berberine treatment may ameliorate ARD-induced kidney injury. So let's see the results. And again, this is a mouse study. We conclude that berberine can improve hypercholesterolemia and redox status, reactive oxygen species, so reduction oxidation, and redox status in the kidney, eventually ameliorating chronic renal injury in rats with ARD, and that berberine can act against pro-inflammatory and pro-fibrotic responses through suppression of the nuclear factor Kb signal pathway. This is amazing. I love it. Because it kind of, again, they didn't use the word curative, they didn't use the word treats, they use the word ameliorates. So I cannot say anything more than that. I cannot say berberine would help fix the kidney, but I would use the same word here for this study, that berberine actually for the chronic kidney disease caused by ARD ameliorates the injury in that kidney. So it's a beautiful mechanism. Of course, so John Snyder says studies show it reduces triglycerides. And I discussed that what happens is, I discussed that yesterday with the liver study. What happens is, as berberine reduces the production of, which enzyme was that? REB, some name, that enzyme that is attached to mTOR1 pathway. When that enzyme is reduced, or when mTOR1 pathway is reduced, that causes less fatty acid synthase, which is another enzyme that makes the lipids. Fatty acid synthase is reduced by berberine, which then causes reduced production of fats or lipids and fatty acids and triglycerides. So it is so interesting that it helps reduce bad cholesterol and triglycerides. So yes, it's a very, very interesting thing. So my study today for in your service, I could not find a good study to show that berberine may be toxic for chronic kidney disease patients. Instead, the studies that I see, they are alluding to, I cannot say they are curative, they're showing cure, they're alluding to the possibility that berberine reduces stress and toxicity going on because of reactive oxygen species and inflammation and the lipids in the kidney, and helping it. One used the word, what was the word they used here? They use this word, alleviates. This is 2022 study, very recent. And the other one used the word ameliorates. So Zizi says that turmeric is known to be a blood thinner, does this. So these are, think about it this way. Those supplements or herbs that are openly available, for example, we eat turmeric every day with our food. These usually do not have as potent an effect that it would cause a huge difference. So our foods have turmeric, and I've been now taking berberine. But once again, if somebody has a scare of blood thinning, then they should just work with the doctor to figure out what is the effect of berberine, what are their clotting labs, and from there they can decide further. So this is the discussion. My takeaway, the summary: no, in pregnant woman, it may be safe for the woman, but not safe for the child. So no. Then not in children, even born children, because the first 2 years of their life, the children are still developing parts of their brain tissues. So berberine can cause the bilirubin to be separated and going to the brain. That can cause brain damage. So children, no. Pregnant women, no. Then there are some drugs for which berberine has interactions. I've listed them all before, so please see the beginning part of this video. But drugs which are working with cytochrome P450 enzyme system, these drugs can be potentiated, and that potentiation may even reach toxic levels if the accumulation is too much. Berberine has a very tiny excretion through urine. Majority of the berberine is in enterohepatic circulation. That means it is excreted through stools. And in that process of being present in the GIT, it is going to modulate microbiota, plus microbiota is going to modulate this substance as well. On the side of kidney, it seems like it is actually more helpful. Now for the first time I used this word helpful. It is, the words they used was alleviate or ameliorate. So this is my word, helpful. There is no study behind that. I want to be very, very careful with the words here. So it seems to be helpful for kidney disease, diabetic or atherosclerotic. So this is the discussion. These side effects, I wanted to put them out so that I can continue on the Berberine series. And then if someone would become excited and go talk with their doctor, at least they'll keep this in mind as well, that here are the things I should be aware of. So thank you very much. Please like, subscribe, and share. Comment as well. Good, bad comments all work. And there are some links in the description if you would like to support this work. And I would see you. Actually, tomorrow I have a business meeting at 5 o'clock. So I won't see you tomorrow. Day after tomorrow, I'll see you as well. Thank you very much. Bye for now.